Hi, my name is Michelle Kelly and I'm an integrative counsellor. I'm a member of the Counselling Directory and founder of a community interest company based in Birmingham and Evesham called Father's Child Services. And we support the most vulnerable in our community around wellbeing and mental health support. I'd like to talk to you today about bipolar disorder, which was formerly known as manic depression. So the diagnosis from the World Health Organization's ICD-10 classifies bipolar under the mood affective disorders, and the official classification is F30 to F39, bipolar affective disorder. So a disorder characterised by two or more episodes in which the patient's mood and activity levels are significantly disturbed. This disturbance consisting on some occasions of an elevation in mood and increased energy and activity, hypomania or mania, and the others of a lowering of mood and decreased energy and activity, the depression. So repeated episodes of hypomania or mania only are classified as bipolar. So let's break that down a little. Some of the key symptoms they describe of bipolar disorder are that people may experience episodes of the depression where they may feel very low or lethargic, so that lack of energy. In mania, they may feel very high or overactive, and others may experience them as being very animated in their presentation. To get the correct diagnosis of bipolar disorder can take a long time. This is because of a few things. Often people will move between having episodes of the mania and the depression, but for each person they experience bipolar in their unique way. For some, that may be over a matter of months they may experience that episode. For others, it may be a matter of years for an episode. Due to the mania element of bipolar, which can bring symptoms of psychosis, it can also be considered part of the psychotic disorders. So psychosis is the overall term for conditions like schizophrenia and bipolar. Three key symptoms that may be experienced are the ones associated with the psychotic episode. Those are hallucinations, where you may experience hearing voices, sensing touch; delusions, where you may be linked to suspiciousness or paranoia, or the unshakable belief in something that may be untrue. Confused and disturbed thoughts, so disturbed speech, for example, someone may switch from one topic to another mid-sentence, or maybe have that sudden loss in their train of thought during a discussion, resulting in an abrupt pause in conversation or activity. The key point to make here is that it is absolutely vital to get the help and support of your GP or mental health team to provide you with a diagnosis, as when acute, which means you are really unwell, medical intervention is going to be vital to get you the help and support you need to start your journey of recovery. This may include medication, talking therapies, and learning new strategies to help you cope better. Some of the statistics say that the sooner you get help in terms of your mental health, the better the outcomes are for your recovery. Bipolar is the fourth most common mental health problem worldwide after depression, anxiety, and schizophrenia. So let's look at answering some of those questions. Can counselling help me? Counselling can help with being able to share what you may be experiencing, having that non-judgmental space to actually process your thoughts and feelings. That can be a really important part of the journey of recovery for you. It can help you answer questions you might have about your diagnosis and help you to understand how to explain it maybe to family and friends. So, what if you've tried to get help before and it didn't work? It can be very scary thinking about getting help, especially if you have tried to explain what has been happening before and you've felt not listened to, or that your voice has not been heard. What I would say is that not everyone is trained to understand mental health, and not everyone feels comfortable talking about it, because historically there has been a lot of stigma around mental health and the way that society has expected people to deal with it in the past. Things have changed a lot, and no one needs to face their journey of recovery alone. So key things to understand are that the journey of recovery is different for everyone. What might work for me might not work for you. So it's really important that you get the support that is right for you. So if you are feeling that you are ready to maybe connect with a counsellor or find some support, you can find me and other qualified professionals on the counselling directory. You can find me at Father's Child Services online at www.afcscic.org or by emailing info@afcscic.org. Thank you for listening.